This is All India Radio Shillong, the Northeast News Bulletin read by Sandeepan Chakravarti. As the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 who have taken the first dose of COVID-19 vaccine to get vaccinated with second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. In view of the increasing number of COVID positive cases, Assam Chief Minister Himanta Biswa Sarma has asked all deputy commissioners to put in place a community surveillance system to avert the pandemic spreading from urban to rural areas. The TCs must use their machinery to put in place community surveillance system to avert the surge of the pandemic. Chief Minister Sarma observed that though most of the districts are witnessing decline in COVID positive cases, the SPs must be strict in enforcing the curfew and total ban on inter-district movement. In Assam, 6 DNLA terrorists were gunned down in an exchange of fire at Karbi Anglong district during the wee hours yesterday. The SP of Karbi Anglong district, Pushparaj Singh, said that the group was involved in the killing of a civilian at Thansiri on the 19th of this month. Meghalaya yesterday recorded 24 more COVID-19 related deaths, taking the fatality figure up to 459 and 803 cases of fresh infection, surging the number of active cases to 7,680. Also, 553 more recoveries from the viral infection added up to 21,542 recovered cases in the state. At present, Meghalaya's COVID-19 recovery rate is 72.58%. Nagaland yesterday registered 13 COVID-19 related deaths, taking the death toll up to 260. The state detected 252 fresh COVID-19 infections, increasing the number of active cases to 4,607. Health officials informed that 214 more positive patients recovered, taking the number of recovered persons to 14,363 so far. Non-governmental organizations in Meghalaya have called for simplification of the process of online registration for vaccination of the 18 to 44 age group, as it has been difficult to find slots on the website. There has been a growing demand for vaccination, but beneficiaries are unable to get appointments despite efforts. The Meghalaya government has taken up the matter with the centre to ensure that there are no hurdles in seeking slots for vaccination against COVID-19. Further, NGOs have written to Chief Minister Conrad K. Sangma for rationalization of treatment of COVID-19 patients in private hospitals, especially in Shillong, as those with modest income are unable to afford the high cost. Manipur Chief Minister N. Biren Singh continued his interaction with home-isolated patients through video conferencing to understand their inconveniences and grievances yesterday. Regarding financial hardship faced by the patients getting treatment in private health institutions, the Chief Minister informed that the government would issue an order notifying rates for treatment with different facilities, including ICU and ventilator supports. He was assured that required medicines, pulse oximeters, and other necessary items would be sent to the home-isolated patients. Several organizations in Manipur continued to donate to the Chief Minister's COVID-19 Relief Fund yesterday. The All Manipur VDF Welfare Association donated their one-day honorarium. The contribution was made by all the VDF members of 16 districts so that it could be used for procurement of necessary items used in treatment of COVID patients. All Manipur Government Drivers and Technicians Association also donated their one-day wages to the relief fund. In Assam, the District Information and Public Relations Officer at Golaghat has taken steps to aware PWD or Divyangas on COVID-19 protocols. Bithika Goswami, a graduate student, has prepared a video of sign language with the support of the Public Relations Officer. This unique initiative is expected to fulfill the need of the Divyangas while making them aware on various COVID rules. And with that, we end the Northeast News Bulletin from All India Radio Shillong. Have a nice day.